Hi, my name is Sigrid Turner, and I am critiquing a movie for Morehead State University NURB 472. This movie that I watched is called The Doctor. It was released in 1991, starring William Hurt. He is a married cardiothoracic surgeon, has one child, about 10 years old, son, and movie starts out as him being your normal typical surgeon, kind of insensitive to the plight of his patients. Um, he's movie begins in an operating room where there's lots of music, dancing, laughing, joking during while he's operating on a patient that had jumped off of a building and had completely dissected his aorta. He ends up saving this patient's life, and through much joking and the whole 9 yards as he goes through. He goes and visits the patient the next day, and the patient, he refers to him as his disease, which is what they normally do. He refers to him as disease or as room numbers, doesn't really know anything personal about the patients or why they are there, or any resources or any uh, help that they may have, or support systems. Um, so it goes on as he's teaching his students, because this is a teaching hospital. So as he goes and sees his patient the next day, um, he's teaching the patients not to get emotionally involved, to that they need to focus on surgery, and not to they need to focus on their surgery and not to get attached or emotionally involved, and just to do surgery, get in, get out, is what he ends up teaching. He ends up throughout this part of the movie, he's kind of has a constant clearing of his throat very frequently, and he goes to see his family physician. Says he's been hoarse for a few months, has a tickle in his throat, and has that constant clearing. Physician writes him a script for antibiotics, and he takes his antibiotics. He goes back, he goes to a play for his son, and while him and his wife are out one night, he starts coughing, and he ends up coughing up some blood. Well, he really doesn't seem to be real concerned about it, but he goes back and he visits his he makes an appointment with the ear, nose, and throat is what it is. I'm sorry. He goes back and he makes an appointment with the ear, nose, and throat, and ear, nose, and throat does a scope in the office and looks at his cords, and just very insensitive, very similar to the way that he is, tells him that he has a growth on his vocal cords, and that they need to biopsy it, and probably need to do it as soon as possible. He is very disbelieving, very shocked, and he leaves, home, goes home early, and is just gets drunk and gets very upset and angry at his wife. And so he goes in the next day. He finally tells her late that evening that he's having a biopsy tomorrow from what they found, and he does go in and has the biopsy. During this biopsy, he does try to pull his trump card of being a physician, but it doesn't get him any more preferential treatment or faster treatment. And the results of his biopsy come back, and he is told very frankly that he has some malignancy, and that surgery is not really an option at this point because he could lose his vocal cords. They don't want to lose his voice, and that is highly unlikely, so he needs to first seek radiation treatment. He goes in for these treatments, this process to begin the radiation treatments, and he's treated as a patient. He's not really involved in the decision making in his care. And during this process, he keeps asking, what are you doing? What are you doing? And he's just kind of absent-mindedly told, oh, well, we're just marking the site. We have to do the scan. We have to do this. We have to do that. Just lay still. And it really brings out how patients are treated sometimes. And how we forget to explain things to the patients and what they are going through. All the stages of grief are dealt with in this movie, and as well as just having just not being aware of what the patients are going through, and you're made aware of the need to explain everything that's going on in the patient's care to them. So, he does try to pull his trump cards. He gets very frustrated during all of these visits. He gets very frustrated, very aggravated. Tells him he's a doctor in this facility. He gets frustrated filling out the same paperwork over and over and over with every different area that he goes to. And he's, but, it's continued. It does not work. He's treated just like any other patient. And so he really feels that. At the beginning of the movie, he is, like I said, he's insensitive to the plight of his patients, to them waiting on him in the office, to how long they wait because he's busy. And you see the evolvement of him as a doctor on a personal and professional level from the beginning of this movie to the end, in how he takes care of his patients, how he becomes involved with his patients, how he no longer treats his patients as a room number or as a diagnosis. He actually starts learning their names, learning about them, learning about their families. So he begins, it's very moving to see that. Throughout his treatment, he ends up having a scope in the middle of his radiation treatments that he has sought, and is told that the radiation treatments are not working, that he needs to have surgery. This is done very insensitively and just very blunt and very frank. He talks with his physician and says, he wants the surgery done in the morning when she starts talking about scheduling in the afternoon, and talks about how he wants it done in the morning because she'll be fresh and be awake and alert. And she, very bluntly tells him that he's the patient, she's the doctor, and he'll have it done on her schedule. He ends up firing this physician, which she becomes very angry, and he tells her that he's fired her due to her insensitivity and lack of caring for him as a patient and as a person, and that this is how he had previously been, and if he had been one of his own patients, he would have fired himself for the treatment that he had been given, and that and he realizes that patients put their trust in him. With him being a physician, he knows more and is not as likely to put his trust in that physician as some patients that come to him without knowing anything. As I said, the involvement of him as a physician is just astronomical, and is wonderful to see. Um, so throughout this movie, he continues working, and he becomes friends with a fellow patient who in the radiation clinic, who has stage 4 brain cancer and has a terminal illness. Um, when he meets a loss or is faced with a loss, such as a biopsy, his surgery, the treatment's not working, he does not turn to his wife. He kind of keeps her very standoffish, or keeps her, at a arm's distance. He turns to the fellow patient, who is female, and his wife does not get upset about that, her being female or her having a friend. His wife gets upset to the fact that she feels lonely, and she feels left out, and she feels like he should be turning to her. So they do begin to have a little trouble in their marriage due to that. The night before his surgery, this friend that he's become very close to, she passes away, and she's not there for him to share his feelings with, or for him to turn to. He has a surgery. He ends up with a tracheostomy. They were not able to save all of his vocal cords, so he's unsure if after the surgery if he's going to be able to speak, if he's going to regain that ability. So his wife is there. She takes care of him, but she has kind of stepped back and removed herself from from the situation. She's trying to protect herself because she has been, he's hurt, she has become hurt from, his insensitivity to her. So he realizes the mistakes he's made, and he does start turning to his family, becomes much more involved with his family, and those problems have ended up being fixed. You fast forward to the end of the movie. He returns to work. He regains his voice. And a patient that we saw him talk with while he was going through his treatments, he goes in and is getting ready to do a heart transplant on this patient. And you see he acts with kindness, and treats this patient as a person. He's very involved with the patient, very sensitive to the patient, very sensitive to the family. And he ends up performing the transplant successfully, and you just see the love that he has for his patient. At the end of the movie, it goes into he's back to work. He's rounding with his students, and he wants to teach his students the concept. He tries to steer them away from treating them as a room number and forgetting that they are a patient and they are a person. So he wants them to learn what he has learned, and that these patients are frightened, they are embarrassed, they are vulnerable, they're sick, they're in the hospital, and they want to get better, so they trust themselves to the physician, to their physician, to them. And therefore, he takes his students in a room and to an ICU, and he gives them names, he gives them diseases, and he puts them in a hospital gown, and he puts them in the hospital for 3 days, so that they will hopefully go through all the tests, all the treatment, and be treated and be a patient. So therefore, maybe they can provide better care to their patients. It was a wonderful movie. and I would recommend it to anybody to see, and to be made aware of, uh, being to have feelings, to treat our patients with respect, with dignity, and remember that they have a personal life, and we should be able to interact with them on a personal level. And that's it. Thank you.